Most people think heart attacks announce themselves. Chest pain, left arm going numb, a dramatic collapse in the middle of the street. That's the movie version. After 60, the most dangerous cardiac events are the quiet ones, the ones that build slowly while you sleep. No warning, no time to call for help. More heart attacks and strokes happen between midnight and early morning than at any other time of day. Not the afternoon, not the morning rush, the quiet hours when no one is watching. And here's what gets me. One of these 5 habits I'm about to show you, your body is already warning you about it every single night, and you're ignoring the signal. But before we get to those 5, I need to correct something I hear from patients almost every week. Some of you are already thinking it. Dying in my sleep, that sounds peaceful. That sounds like a blessing. I hear this in my clinic more often than you'd expect. And I need to correct something because that is not what happens. What actually happens far more often than people realize is a stroke. Your brain loses blood supply on one side, and you survive. You wake up, but you can't move your right arm. Words won't come out right. Getting dressed, feeding yourself, someone else has to do that now. And the worst part? You might not recognize your own grandchildren's faces. That is what a nighttime stroke actually looks like. Not a peaceful exit, a life sentence. And the 5 habits I'm about to show you, they are quietly setting that up every single night. So, no, this isn't about dying peacefully. This is about not waking up as yourself. Before I go any further, tell me your country down in the comments. I like knowing who's in the room tonight. And if any of this is already landing, subscribe and stay with me. The small nighttime things are exactly what I make these for. That is why I started this channel. I'm Dr. Kemi Lawson, internal medicine, 15 years, mostly in a community clinic with patients over 60. I started it because of one pattern: people leaving with a prescription, but not enough information to actually protect themselves. So the same mistakes repeat before bed, night after night. Tonight, I'm going to show you 5 of those patterns, and then exactly how to fix each one, starting tonight. But first, tell me in the comments, how old are you and how many of these 5 do you think you'll recognize? Be honest, I read every single one. All right, let's start with the one that surprises people the least, but does the most quiet damage. What time did you eat dinner last night? I ask every patient that question. And for a surprising number of people over 60, the answer is somewhere around 8 or 9 at night, sometimes 10. A full plate, rice, pasta, something fried, then the couch, then bed within an hour or 2. I get it. Honestly, I've caught myself doing this. Long day, dinner at 9, bed by 10. It's not laziness, it's just life. But from a cardiac standpoint, here's what you're doing to yourself. And here's the part that frustrates me. This almost never comes up at a regular checkup. Nobody asks you what time you eat dinner. Nobody connects it to your heart, so you keep doing it year after year. When you eat a large meal, your digestive system demands a massive increase in blood flow. Your heart has to pump harder, blood pressure goes up, the fats in your blood, triglycerides, spike sharply within 2 to 4 hours after eating. Now layer that on top of going to sleep. Think of your heart like a night shift worker who was promised a quiet evening. Instead, you just handed it a double shift. Digest a full dinner and run the overnight maintenance your body depends on. Those 2 jobs are in direct conflict. Something has to give. And in a person over 60 with any degree of arterial stiffness, that conflict has real consequences. Research has consistently shown that eating within 2 to 3 hours of sleep is associated with elevated nighttime blood pressure, higher rates of acid reflux, which can actually mimic cardiac symptoms and trigger real ones, and increased risk of cardiovascular events during sleep. So what do? Finish your main meal by 6 or 7 in the evening. That's it. Not a radical diet, just a reasonable dinner at a reasonable hour. If you need something later, keep it light. Lean protein, vegetables, not a feast. You're giving your heart a full 3 to 4 hours to settle before sleep. Makes sense, right? And I'm curious where you land on this one. Comment yes if your dinner usually lands after 8 at night, and no if you're already sitting down by 6 or 7. No lecture either way. I just like seeing how the evenings really break down. But the meal is only the beginning. What you take after dinner or forget to take might matter even more. This one I need you to take seriously because this is where I see the most preventable damage in my practice. Now, this is one of those things your doctor probably knows but never had the time to bring up. If you're over 60 and you take medication for high blood pressure, and statistically more than half of people in that age group do, the timing of that medication matters enormously. Most people take their pills in the morning. Their doctor said once a day, so they take it with breakfast. Seems logical. But here's the problem. Your blood pressure follows a curve through the day. It rises in the morning, peaks in the afternoon, and normally dips at night, usually 10 to 20% lower. That nighttime dip is supposed to happen. It's part of how your heart recovers. But a significant number of people over 60, particularly those with hypertension, don't get that dip. Their pressure stays elevated, or it actually surges in the early morning hours, around 3 or 4 a.m. This is called nocturnal hypertension. Most people have never heard of it, and it is dangerous in ways that daytime high blood pressure is not. Your blood pressure medication is basically a security guard. If your guard clocks out at midnight, but the break-in happens at 3 a.m., what good was that guard? A pressure surge at 3 in the morning hits your arterial walls very differently than one at 3 in the afternoon. The walls aren't braced for it. It's more likely to rupture a vulnerable plaque, more likely to trigger a clot. So what should you do? Talk to your doctor, specifically about timing. There's ongoing research suggesting that evening dosing may better protect you during those vulnerable overnight hours. The conversation takes 2 minutes. Ask one question. Should I be taking my blood pressure medication at night instead of in the morning? That single question could be the most important thing you ask your doctor this year. And I'd bet most of you watching have never once had that conversation. All right, this next one, it's driven by something completely logical. And that's what makes it easy to miss. But keep something in the back of your mind. We still haven't gotten to the one your body is warning you about every single night. That's coming. Many people over 60 deliberately cut fluids in the evening. The reason makes perfect sense. They want to avoid getting up at 2 in the morning to use the bathroom. Disrupted sleep, fall risk in the dark. I completely understand. But from a cardiovascular standpoint, going to bed even mildly dehydrated is a real risk factor, and almost nobody talks about it. When you're dehydrated, your blood gets thicker, more viscous. It doesn't flow as freely through your vessels. You know what happens to oil when an engine runs low? It thickens. Same thing with your blood. And thick oil through narrow pipes doesn't flow, it clogs. For a younger cardiovascular system, that's manageable. For a person over 60 dealing with arterial stiffness and plaque, it's a different story entirely. Now combine that with what happens during sleep. Your heart rate naturally slows, blood moves more slowly. You've been lying still for 7 or 8 hours. Your arteries may already be narrowed. Thick blood, slow circulation, reduced movement, narrowed vessels. That combination is one of the reasons strokes and heart attacks cluster in the early morning hours. Research has shown that higher blood viscosity is directly associated with wake-up strokes, particularly in older adults. Actually, let me say that more plainly. Thick blood in the early morning hours is one of the main reasons people have strokes before they even get out of bed. Now, I know what some of you are thinking. Doctor, if I drink water before bed, I'll be up 3 times a night. I hear this every single week. So here's what I tell my patients. Don't drink a full glass right at bedtime. Instead, sip 4 to 6 ounces about 2 hours before you go to sleep. That's enough to keep your blood from thickening overnight without flooding your bladder. Keep a nightlight on the path to the bathroom. That handles the fall risk. And keep a glass of water on your nightstand for when you wake up. That moment of thirst at 2 a.m., your body is asking for something your heart also needs. A small bladder trip is inconvenient. A blood clot is fatal. You can handle inconvenient. And look, if that just connected something for you, if you're rethinking your evening right now, take 1 second and hit subscribe. It helps this reach more people over 60 who need to hear it. That's the only reason I ask. Okay, now, at the very beginning of this video, I told you one of these 5 habits your body is already sending you a warning signal about. Every single night. This is that one. I want you to think about someone you know who snores, a spouse, a parent, maybe yourself. That sound, that loud, irregular rumbling in the night. Most people treat it as a joke, something to elbow your partner over. I treat it as a cardiac warning sign, until proven otherwise. Sleep apnea is one of the most underdiagnosed conditions I see in patients over 60. It's estimated that more than 30% of older adults have some form of it, And the vast majority, never diagnosed, never treated, they have absolutely no idea what it's doing to their heart. Here's what actually happens during an apnea episode. You stop breathing for 10 seconds, sometimes 40 seconds, sometimes longer. This might happen dozens of times per hour. Each time, the oxygen in your blood drops sharply. Your brain registers a crisis and fires off a stress response. Adrenaline, cortisol, a sudden spike in heart rate and blood pressure. Your heart essentially jolts awake while the rest of you is still asleep. Now imagine that happening 30, 40, 50 times in a single night. Imagine someone shaking you awake every 90 seconds, slamming the panic button on your heart, then letting you fall back asleep only to do it again and again and again, night after night, year after year. Your heart never gets a real break. Sleep apnea has been linked to a significantly higher risk of serious cardiac events. Some studies put that number at 2 to 3 times higher. It's strongly linked to atrial fibrillation. That's when your heart starts beating out of rhythm, fast and erratic, and that alone dramatically raises your stroke risk. And because you're asleep for all of it, you often have no idea until something serious happens. The warning signs: loud snoring, waking up with headaches, feeling exhausted even after a full night's sleep, dry mouth, a choking sensation. Sound familiar? If you snore heavily, you're over 60, and you have any history of heart disease, getting a sleep study is part of your cardiac care. I'd recommend you take that seriously. And look, I know the CPAP machine isn't glamorous. Many of my patients stop using it because it's uncomfortable. I get that. But now that you understand what's happening to your heart 40 times a night without it, that machine isn't an inconvenience. It's a shield. Now there's one more, and this one will surprise you because it sounds too simple to matter. What temperature is your bedroom right now? Most people have never once thought about this in terms of their heart. They think about comfort, personal preference, maybe what the electricity bill looks like. And I know what you're thinking. It's just the thermostat. How could that possibly matter? Stay with me. There's a specific range your cardiovascular system prefers, and outside of that range, your heart is quietly working harder than it should. Too warm, above about 72 degrees Fahrenheit. Your body spends the night trying to get rid of heat. Blood vessels dilate. Heart rate stays elevated. You sweat more, which means you lose fluid, and now we're right back to the dehydration problem. And critically, you spend less time in the deep sleep stages where your heart gets its best overnight recovery. Too cold, below about 60 degrees. Different problem. Your blood vessels clamp down to preserve core heat. That's vasoconstriction. Blood pressure rises. Your heart has to push against more resistance. For someone with existing coronary artery disease or hypertension, that nighttime pressure increase is not something to shrug off. The sweet spot? Between 60 and 67 degrees Fahrenheit, roughly 16 to 19 Celsius. Your heart has a narrow comfort zone at night. Push above it, it's working overtime trying to cool you down. Drop below it, it's clenching against the cold. Hit that window and you're giving it the one thing it actually needs, a chance to rest. One thermostat setting, real protection. Oh, one more thing on this. If you're someone who piles on blankets because you hate being cold, that works. The room should be cool. You can be warm under the covers. It's the air your lungs are pulling in that matters. Now, everything I just described, every single one of these 5, one woman was doing all of them. Let me tell you what happened. Let me tell you about someone I'll call Carol. 71 years old, a retired seamstress from a small town in Michigan. Carol came to see me after her second trip to the emergency room in 3 months. Both times, the middle of the night. The first time, her heart was pounding so hard and so fast she was sure that was it. The second time, she woke up and her right hand simply wouldn't work. When I sat down and walked through her evening routine with her, all 5, every single one. Dinner around 9, usually in front of the television. Her blood pressure pill every morning with her coffee. She'd never once thought to ask about the timing. Her daughter had been telling her for years that her snoring shook the walls, and Carol just laughed it off. She'd cut off all water after 4 in the afternoon so she wouldn't be up in the night. And she kept the bedroom at 76 because the cold got into her hands. We changed all 5. Dinner moved up to 6. Blood pressure medication switched to the evening with her own doctor's sign-off. A sleep study came back showing moderate apnea, so she started on CPAP. A few sips of water a couple hours before bed. Thermostat down to 66. No more ER visits. Her blood pressure numbers came down, and she sleeps through most nights now. Here's what she told me. For years, I went to bed half wondering if I'd open my eyes again. Now I lie down knowing I did everything I could, and that quiet is worth more than any pill. 5 habits, 5 fixes. Here's what your evening should look like. Between 6 and 7 in the evening, your main meal. Lean protein, vegetables, a moderate portion. Not a feast, just a proper dinner at a proper hour. At 7, your water, 4 to 6 ounces, and your evening medication if your doctor has approved the timing switch. Between 8 and 9, your wind down. A gentle walk, some reading. Step away from the phone screen. It suppresses melatonin and keeps your nervous system alert longer than it should. By 9, check your bedroom. Thermostat between 60 and 67. Nightlight on the bathroom path. Glass of water on the nightstand. 90 seconds. That's all it takes. By 10, you're in bed. On your side if you snore. 5 habits, 5 fixes, 1 evening, and every single one of them is free. Now, I need to say one more thing, because I know what some of you are feeling right now. I know I've given you a lot tonight, and I don't want you lying in bed worrying. That is the opposite of what this video is for. This is not about fear. This is about control. Every single fix I just gave you is something you can do tonight in your own home for free. You don't need a prescription. You don't need an appointment. You don't need permission. You just need to decide. You're not helpless. You're informed. And that right there is the difference between the patients I see in my clinic who had no idea and you right now watching this. If there's someone in your life, a spouse, a sibling, a friend over 60, who has never once connected their nightly habits to their heart, send them this video. You might not be able to sit them down and explain all of this, but you can share a link, and that could be the most important thing you do for them this week. One last thing. Everything I've shared tonight is general medical information based on current cardiovascular research and my own clinical experience. Before you change anything, especially your medication schedule, talk to your own doctor. That's not a legal line. That's genuine advice from someone who wants you still watching this channel 10 years from now. Good night. Take care of that heart. It's been working for you every single night of your life. Give it what it needs to keep going.